Hello everyone, my name is Dr. Kumar and this is our part 3 for this topic. So let's talk about with a case today. So for suppose you get a 58-year-old female with iron deficiency anemia whose hemoglobin is 6.8 gram per deciliter. That is because of the chronic GI blood loss, and she is admitted to the hospital and you are transfusing the red blood cell to this patient because your cutoff of hemoglobin is less than 7 here. So she has a history of 2 prior pregnancies, 1 prior transfusion, and about after 45 minutes into her first unit, she developed a temperature. Her baseline temperature was 37 degrees centigrade and now she is 38.4. And then she also has chills, rigors, and then you check the blood pressure. Blood pressure is stable, oxygen saturation is normal, patient denies any back pain, there is no dyspnea, patient doesn't have any rash, all things are normal. So what is your diagnosis? So this is febrile non-hemolytic transfusion reaction. So let's deep dive into that. So febrile non-hemolytic transfusion reaction happened because of the 2 mechanisms. One is the recipient antibody mechanism. What does it mean? So if someone is exposed through pregnancy or prior transfusion, so the patient develop anti-HLA and anti-granulocyte antibodies. So these antibodies react with the donor white blood cell, leukocyte, in the transfused blood, and they trigger the release of interleukin 1, 6 and TNF alpha. That's why the patient develop fever. And it is more common with the RBC transfusion. And the second mechanism is cytokine accumulation during the storage. So when you store the blood for the longer time, so the leukocytes in the stored blood release cytokine, and those cytokines are interleukin 1, 6, 8, TNF alpha, and these accumulated cytokine, when you transfuse, they directly cause fever even without antibodies, and this is a major mechanism in the platelet transfusion. Now you know about the mechanism of action. Let's talk about the clinical feature. Patient will develop fever, chills, rigor, and the temperature requirement is 1 or more than 1 degree centigrade from the baseline. So what is your treatment? So first of all, anytime if you see any transfusion reaction, first thing you have to do is stop the transfusion. Then you rule out the hemolysis. You will order the labs which can rule out the hemolysis. You rule out the sepsis in this patient. You see if the patient don't have any low blood pressure or something else. And then you can give the patient acetaminophen for the fever. And you can give sometime meperidone if they have uncontrolled rigors. Now the big question is here, how you can prevent it. So if you understand the mechanism of action, you know how to prevent it. You can prevent it by leukoreduction of the blood. If you remove the leukocyte from the blood, then you can prevent this reaction. And the bonus point, pre-medication with the diphenhydramine or acetaminophen does not reliably prevent the febrile reaction. Now the question for you is, how does meperidine treat the rigors?